Hi everyone, my name's Jo. I'm a nurse practitioner student at Franklin University, and today I'm going to do my video presentation on Acne Vulgaris. So just a quick overview on what we will discuss in this video is the history and physical presentation of Acne Vulgaris, the risk factors that we can see for people who are susceptible to acne, onset, when to expect that. We're going to look and see some examples of different stages of acne, go over treatment and different management of acne, as well as some patient education and considerations. Okay, so a quick overview of acne. Acne is an inflammatory disorder of the pilosebaceous units. The pilosebaceous units are present in your mid-dermis, and they consist of the hair follicle, the hair shaft, and the sebaceous gland. Most likely you will see acne presenting as papules, pustules, or nodules, and they are usually presenting on areas such as the face, chest, back, or arms, as those areas have the most hormonally responsive sebaceous glands. So let's talk about some risk factors for acne. Acne is a very common dermatologic condition that we see through young adults and adolescents. However, things like medication, lithium, or we see patients who are on testosterone replacement therapy. A big side effect they deal with is the acne. That is due to the testosterone increasing the circulation of androgen, and androgen has a direct response to the sebaceous glands themselves. Other risk factors, excessive sunlight exposure, endocrine disorders, PCOS, for example, or even pregnancy, the changes in hormones there. There are genetic factors. If your first-line relative, your mom, your dad, your sibling has severe acne, you may also be likely to experience acne. Acne can also be a psychological stress response, so that can also be a risk factor for acne. All right, so when do we expect to see acne present? Most common, like we discussed, acne is present in adolescents, may start as early as 7 to 12 and go on up to the third decade of their life. There are some medications that we see if they're on testosterone. The symptoms of acne usually peak after 6 months of being on testosterone. Acne may also be present in neonates due to the circulating hormones from delivery and birth. However, acne in children ages 1 to 6 is uncommon, and it usually warrants a workup to see other causes as well. So the severity of acne vulgaris is graded based on the presentation of the lesions. Mild acne just presents with the comedones, the whiteheads, the blackheads, some papules or pustules, and then we get into the grade 2, which is our moderate or pustular acne. So that is where you will see multiple papules and pustules. Grade 3 is our moderately severe or nodule cystic acne. That is where the papules and pustules are present with inflamed nodules as well. That is where we'll see involvement of the back and chest. Grade 4 is severe nodule cystic. That's where you'll see large, painful, and inflamed pustules and nodules. You may also see cysts and abscesses are also present. That's where we see a lot of scarring. And on the next slide, we will see the different acne staged. So here are the examples of the different stages of acne. Now, one thing to consider, obviously there's a big difference between just the whiteheads and the blackheads in stage 1 versus nodules, cysts, and scarring in stage 4. However, it is important to consider the patient's quality of life and how they are affected. Some patients, especially teenagers, may not mind having some acne. Others may have a lot of issues dealing with image or appearance, and that needs to be in consideration when planning treatment. All right, so treatment of acne. Treatment is based off our severity. So if we have mild acne, we are going to use a topical therapy approach with topical retinoids, antibiotics, and antimicrobials. Your antimicrobial will be your benzoyl peroxide. You also can use antibiotics such as clindamycin or erythromycin. In cases where the acne warrants use of antibiotics, you also want to use that with the benzoyl peroxide to prevent antibiotic resistance. Topical retinoids, such as the tretinoin, are also used to treat mild acne. For moderate to severe acne, that's where you need to take a topical and systemic approach involving antibiotics. You'll choose a tetracycline, usually doxycycline. You'll be on that for a couple months to get over that infection, and then you will continue to do like a oral retinoid such as isotretinoin, and you can do oral contraceptives if your acne is related to hormones, such as cases with PCOS. One thing to consider with that is not to use progesterone-only contraceptives, as that actually exacerbates acne. Spironolactone is another one that is seen to prevent acne. It also interferes with the androgen levels to help reduce that acne. And then the iPledge program is something that is used when prescribing the oral retinoids. You usually refer that to dermatology. There is a lot of involvement. Any patients who are able to get pregnant need to use 2 forms of birth control as well as have a negative pregnancy test. They have to sign up for this program and get tested for pregnancy before refilling. Some other aspects of acne treatment I did want to mention: sunscreens, azelaic acid, that can be used to treat the hyperpigmentation after acne. Keep in mind, the goal treatment for acne is to prevent future lesions. There are other laser treatments or acid treatments that help with the erythema after the inflammation. And some lesions or cysts may need excision. These are all done with dermatology. Of course, for any severe acne, you can always refer to dermatology. Here are my references. I also attached the URL for any images I use right under the picture. Thank you, everyone, for listening.